Often people think that people in poverty are lazy or they should know how to take care of themselves. They look at somewhere like the Philippines, a tropical environment, and they say, well, they can just grow food. Why aren't they just growing their food? But they fail to understand the complexity of poverty and the contradictions of poverty. If you want to try and understand the mindset of someone in poverty, you have to put yourself in a shoe where nobody has ever been able to, because of their own poverty, or willing to, even teach you the simplest thing. You don't know that the seed goes into the ground because nobody taught you. You don't know that washing your hands after the toilet prevents the diarrhea that killed your child 2 weeks ago because nobody told you. But not only that, nobody gave you the resources, so you don't even have the seed, you don't even have the clean water, you don't even have the soap. So you're really looking at such a complicated, long-term situation for these people.
Severe poverty is the norm in large parts of our world. At ICM, we've been working with the poorest of the poor in the Philippines for more than 20 years, and we've developed some strategies that are amazingly effective.
ICM is working only with the ultra-poor people of the Philippines. Ultra-poor referring to people living below the subsistence level and on less than 50 US cents per day. These people are living in desperate situations. The homes that they live in are in terrible condition, clean water is rare, food for their family is scarce, and the mortality rate is extremely high. Understandably, these people have little hope for the future, and their children are bearing the cost for this. But what if? What if we were able to give them the education, the training, and the time that they needed to build a future for their families? So how do we equip these people? Well, ICM will partner with the local churches to identify 25 of the poorest families in each community. Then we will get these family members and bring them to a training session in their own community where we will teach them about values, health, and livelihood. Now, our trainings are designed for a semi-literate audience who are best taught orally, and our training materials are written, but they contain a lot of pictures to make sure that the participants know exactly what is being taught. Our values training builds the foundations of hope, because unless the poor can feel optimistic about the future, how are they expected to implement the rest of the lessons we're trying to teach them? One way in which we do this is we will visit the homes of each participant weekly to answer their questions and show that we care for them individually. ICM's health training is based on a UN curricula, and it teaches the basics of disease prevention, nutrition, hygiene, and other health information that is essential to the daily lives of the poor. ICM's health training is cutting the incidences of chronic illnesses in half. Our livelihood training focuses on low capital projects such as organic vegetables and worm farming. Last year, we distributed nearly 15 million seeds to the participants in our programs, and we now have over 1 million worms producing organic soil. ICM has a pretty big footprint in the Philippines, with 300 full-time staff working with leaders in around 2,000 different communities. In fact, last year alone, we ran our VHL program in around 500 different communities, training nearly 100,000 family members in our VHL program. We are changing the face of poverty in large sections of the Philippines, bringing hope to one parent and one child at a time.
We never leave because we always leave the pastor there. So if that person needs assistance again or help in the future, then the pastor is always there, locally, ready to help.
The pastors are the heart of ICM. They are the community leaders. They have integrity, honesty, and a reputation in the community as a people that are trusted and well regarded. They come to us to avail the program because they really want to see community transformation. They want holistic changes to communities. They live there, they work with the people, and if the people are blessed, I think they will also feel blessed in achieving their dream.
The small beginning should be nurtured so that we could see the fruit, and the transformation is not only impacting the individual poor families, but really impacting the community.
ICM is a great help to our community.
Because through this program, every time we visit their house, we are very much welcome.
It's just like a big family. I just go there every Sunday, but the work goes on.
Our communal garden is sustainable because our plant is all season.
Saving money, they don't have to go to hospitals. They learn to do the first aid.
They learn how to have a family planning.
The biggest change that takes place in the community up to now is the peace.
Change in their lives socially, spiritually, sa health, and also morally because of the values.
Because what is the use of livelihood without values? What is the use of health without values? I think value is the key to all the programs.
And I believe myself that ICM is the long arms of God to fulfill our mission and visions in the community.